special, there's only one name to remember.
Mumtaz Leeds.
Relax in our newly refurbished Riverside restaurant.
Enjoy exquisite home cooking from our brand new menu. Upgrade to the Mumtaz Leeds experience.
And the price? Well, we're better value than ever before.
Mumtaz Leeds, Chadwick Street, Leeds, LS10 1PJ. Call 0113 242 4211.
Free car parking available.
कोई रत्तियां कमीज़ानी लमाना मारे मामा मिठिया में चीज़ानी।
मेरा नाम मुकद्दस है और कोट मेरा घर है और ये मेरे लिए किसी जन्नत से कम नहीं। हमारे भी कुछ ख्वाब हैं जिनकी ताबीर को हमें पाना है।
आइए इन बच्चों के ताबनाक मुस्तकबिल के लिए अपना हिस्सा डालिए। अपनी ज़कात, सदकात, खैरात और इमदाद कोट को दीजिए।
UK नंबर 0300 123 774। वेबसाइट court.org.uk।
Alma-Rad Tiles. With over 70 stores nationwide, we are now open in Peterborough. Up to 50% discount offers now on. Largest selection of tiles. Full bathroom suites from only £189. Paint, LED lighting, laminate flooring from only £7.99. Over 1,000 designs of wallpaper in stock. We have everything you need. Come and visit us at 193 Fengate, Peterborough, PE1 5BH, or call us on 01733 34 58 47. Alma-Rad Tiles, now open.
In the mood for some authentic Desi food? Try Desi Restaurant on Lincoln Road. Start your day right with our Desi breakfast. Every day from 7 a.m. to 1 p.m. Halva puri, channa, nihari, paya, paratha and omelette. Need a tasty lunch? Every day 1 to 4 p.m. we've got fast food, pizzas, kebab sandwiches, tandoori dishes, balti dishes, biryanis and much more. We're also open every evening 5 p.m. to 1 a.m. Try our Desi Tawa special or our fresh handi, 1 kg chicken or lamb on the bone, cooked to order. Eat in, take away or free delivery. Visit desirestaurant.co.uk to view the full menu and order online. 60-seat capacity and a private function room. Catering service also available. Desi Restaurant, 298 Lincoln Road, Peterborough, PE1 2ND. Call us now on 555 795.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Yes, I'll come back and greet you again once I've said that we've gone on air. My very trusted partner in crime, well, not exactly in crime, Sister Michelle, who's the station manager, has just told me that we need to be listened to and heard to. So I've just pushed a few buttons, and I hope that hopefully they're all the right ones as well. It's Dr. Shabina Sidkiyoum for the Body, Health and Mind Show on Salam Radio 106.2 FM. Welcome to this show. And it's the first show of the new year. How wonderful is it to start this year off with an extremely pertinent and important topic. So we do need you to all come on board and listen to this show. We do try to get experts in their various fields to give you the latest updates in the world of medicine. And if you don't know me, I'm a local GP who works in a little practice within Peterborough, and I love what I do. I love being a GP. I love seeing patients. So come on board and watch us on Facebook Live. We've also got YouTube Live. We've got Twitter Live. And we're also on Instagram. And as always, it's wonderful to see your support of the show. And please do put forward your questions if you have anything in regards to the topic, which I will be informing you about. So if you want to text and WhatsApp us, just text us on 07745278978. Or if you'd wish to talk to us about today's topic, our number to ring is the Peterborough code 01733 602 133. And I'd like to wish you a very happy new year. And I hope that you've all had a positive start to the new year and the children have all gone back to school. And I always start my show off with a shout out on my show. And this week's shout out is going to go to a little girl called Isa, whose mummy baked me a beautiful cake, and she came to meet me, and she was very confident. She was lovely, and I really did like her t-shirt that she was wearing at the time. So I think that she deserves a shout out on the show. So Isa, if you're listening, this show's dedicated to you. And actually, it's my 15th wedding anniversary today, if you all didn't know. So yes, it's a wonderful way to be celebrating it, talking to the whole of Peterborough, hopefully. So without further ado, let's get on, and I'm going to introduce you to my wonderful guest who I have here in the studio. In front of me, I have Nicky Srahan, who is a school immunisation service lead in Cambridgeshire, Peterborough, Norfolk and Suffolk, which is an enormous area. We also have Laura Watson, who is the school immunisation team lead in Cambridgeshire and Peterborough. And we have Dr. Shyla Thomas, who is a public health consultant in Cambridgeshire, Peterborough, Norfolk and Suffolk. Greetings and good evening to you all, ladies. So let me just put your mics up. Good evening to you all, ladies.
Hello.
Hello.
Thank you very much for your time coming here today. And it's a very important show. It's a very important topic, as we all know. And there are lots of discussions around this time of year, starting from the beginning of October all the way through this winter period, isn't it? And there's obviously a build-up period in preparation for it. Would you like to tell me, Nicky, who are you as a service and what do you do?
We're the school age immunisation service. We cover the whole of East Anglia, but specifically for tonight, I'm with Laura Watson, who's the team leader for Cambridgeshire and Peterborough. So we offer school age vaccinations or immunisations in all Cambridgeshire and Peterborough schools. At the moment, we're just coming to the end of our flu programme, which is for all children from reception up to year 6. And in 2 weeks' time, we're moving on to the HPV vaccination programme, which is for year 8 girls and boys and year 9 girls. And then the following term, we'll be doing meningitis, ACWY and diphtheria, tetanus and polio vaccinations.
That's wonderful. And Nicky, do you actually administer the flu vaccine yourself within?
I rarely do it these days. I am a nurse. Laura does a lot more than me because she's on the ground as the team leader in Cambridgeshire and Peterborough.
That's wonderful, Laura. Would you like to tell me a little bit about what your experience has been over the last few months trying to deliver this programme?
Well, it's an extremely busy programme because it's about 70,000 children across Cambridgeshire and Peterborough that are eligible to have the vaccination.
Sure.
And obviously we're really busy. In fact, I'm going to start planning next year's flu vaccination. We just finished, we're beginning to finish last year's, so I'm now starting to think about how we're going to plan for 2020. So there's an awful lot of work goes into it, and it's extremely busy. I think we've got 350 schools that we need to fit in 10 weeks. And we're not a big team. We're only 10 nurses and 10 admin staff, along with the help of bank staff. So it really is a full-on programme, but it's very enjoyable. It's lovely to go in and see the young children.
Yes, I can imagine it must be, especially when you've got that lovely age range between reception and year 6. So you have all sorts of behaviours that come through the door, I can imagine.
But they're really, really well-behaved, the children, and they take to it quite well. You know, be very surprised at how well they cope with coming and seeing we're strangers to them. Yeah. So, but they cope really well with it.
Brilliant. And is part of that because the flu vaccination for children is given through the nose? It's a squirt, isn't it?
Yes, it is. It's just 2 sprays, one up each side of the nostril. Okay. It doesn't hurt. And we're very careful to explain to the children what's going to happen when they come to see us. And yeah, generally, some are nervous, and that's okay because we are strangers at the end of the day. Some of them may not have had it before. Yeah. But generally, on the whole, they all end up having it done, those that want it anyway.
That's great. That's great to hear. Well, it sounds very promising, and it's wonderful to hear the positivity and the dedication that you have behind it, because that's an instrumental part in actually loving what you do, isn't it?
Well, absolutely. We're all, first of all, we're all mums, but we're all very proactive. The idea is to protect the whole community from whatever virus we're protecting them from. It might be flu, might be HPV, whatever. But the idea is to get a really good uptake, because then you're actually protecting not just the individual child, which is great, but you're actually wanting to protect the whole community, because there's people out there that actually can't have the vaccination.
That's right.
Due to ill health, and they're the ones that really that you want to protect. And you know, the more children we get vaccinated, the better the whole community is protected.
Absolutely. There, I completely concur with your views on that, and that's an aspect that's known as herd immunisation,
That's right,
isn't
yeah.
it? Now, coming to yourself, before we come to Dr. Thomas, Nicky, you cover a very large area, obviously, and you might not have the definitive answer to this, but each area definitely has its challenges, doesn't it? Peterborough won't be excluded from that. What particular challenges are you facing here within Peterborough when it comes to service delivery?
Peterborough is obviously an inner city community, so that has operational issues. But the biggest difficulty here is getting the uptake that we get in the other areas. So although we've seen an increase in uptake this year, the uptake isn't as good in Peterborough as it is in the other counties, Cambridgeshire as a whole, or Norfolk or Suffolk. And I think that has to do with the gelatine component of the nasal flu vaccine.
Sure. And we will definitely talk about that, because that's a very important issue, especially here within Peterborough, and I see it within primary care as well, so we'll have a conversation. Now, Dr. Thomas, thank you for joining us today. I'd like to ask you if you could give our listeners a little bit of the overview on how the flu vaccine actually works.
Yeah, so in terms of the childhood flu vaccine that we were just discussing, that the nasal squirt one, it's called Fluence, or the LAIV, the live attenuated vaccine.
Yeah.
And it is, because it is live attenuated, it's a modified form of the live virus, which will, when it's squirted into the nose, it will get in and induce immunity against the flu virus. That takes 2 weeks to develop. And it covers 4 strains of the flu vaccine. Okay. And that is, the strains are recommended by the World Health Organization, WHO, about 6 months before. They take, they study the flu viruses circulating in the southern hemisphere, and they also look at the flu viruses that were circulating the previous flu season, and they make a recommendation on what flu types should be covered in the vaccine.
Okay.
And based on this, vaccine manufacturers start the production of the vaccine. So there's the nasal flu one, which is not an injection, which is very good, which works very well for children. And the other ones are the injectable vaccines, which are the killed vaccines. And they are given in people at risk, like the older people, the younger people at risk with various conditions like heart disease, liver disease, kidney disease, respiratory conditions, etc. So across the ages from 6 months on to people, very old people, there are different risk factors for flu. And people with risk factors, we recommend them to have the flu vaccine. And those who are in the community, like working age adults, older adults, and older people, go to their GP for the flu vaccinations. In school age children, like Nicky and team do, they go into the schools to offer the full flu vaccine.
Yeah. So I guess what I'd like to ask is that it's a live attenuated vaccine. I often get asked this question within primary care, and I think that it would be nice to say that or ask the question that those at-risk adults that are given the injectable vaccine, which is the killed strain, are people more at risk of developing sort of a viral type of illness after the live strain is given to them any more than or compared to the injectable version that has the killed strain? That's a question that I'm often asked, and I'm a little bit stumped for answering it. So do you have a sort of an answer to that?
So the live attenuated vaccine is a different form of flu virus. So it's modified significantly so that it doesn't cause the illness, but it has the ability to produce the antibodies.
Okay.
So children may get some slight symptoms, but it's not the actual flu illness they get. It's just their body responding to the and responding to the vaccine and ensuring that the antibodies are produced. So by 2 weeks they will have the antibody circulating in the body, and when if they come in contact with the actual flu virus, the antibodies will kick in and do their work to protect the child. So in children, the main way it works is it gives individual protection, that the child is protected from the 4 virus strains if they come in contact with them. And also they will not be circulating the virus. So children are mainly called super spreaders because they get the flu infection, they take it to their home and spread it to their grandparents, uncles, aunts, and because children get the illness and they spread the virus quickly.
Yeah.
If we break the transmission there, then the flu circulating in the community will also stop. And hence older people and adults at risk from various underlying conditions are also protected.
Right.
Yeah, so that is why the live attenuated one is slightly different from the killed one. But the thing is, it protects against four strains of the vaccine. And because it is live attenuated, the antibodies produced is much more potent and much more immediate and much more protective than the killed virus.
Sure.
Yeah.
So I guess what it is that there is a little small chance of developing things like temperature, low-grade fever, etc.
Very, very small chance.
Very
yes.
small chance.
Yeah.
But nothing more than the injectable version.
No. Injectable version causes a lot of local pain.
Okay.
And some sort of muscle ache. But
sure.
Yeah, people, because there are so many other viruses spreading around in winter. If they, there will be cold and flu, there will be other cold and cough and cold and other viruses that cause cough and cold in the community. So people will think, I took the vaccine, now I've got a cough and cold. Is it because I took the vaccine I got it? It's not because they took the vaccine. It's because there are so many other viruses circulating in the community in winter.
Okay.
Yeah.
Thank you very much for that. Very comprehensive answer, and it's been very useful as well. I'm sure that the listeners would agree. And if you've just tuned in to Salam Radio, this is the Body Health and Mind Show with Dr. Shabina Asad-Kiyum on Salam Radio 106.2 FM. You are very welcome to ask any questions on the Facebook Live page, or you can text and WhatsApp us on 07745278978. And I'm joined in the studio by Nicky, Laura and Dr. Thomas as well. Now, Nicky, regarding service delivery and service provision in Peterborough, how much have we done and how much have we got left to do?
We have been into nearly every single school in Peterborough since October.
Okay.
We've got a couple of more schools to do this week, but we are finishing off the flu programme this week or next. We're offering a community clinic in this coming week also. So parents of children who have missed the flu vaccine can still make an appointment and get vaccinated because the flu season is still happening. It's hit a little bit sooner than other years in that it increased over Christmas, and actually the strain of vaccine that is circulating is in the vaccine, so that's really good news. We know that the cocktail in the vaccine is right this year, that the children will be protected. So our number to make appointments is 0300 555 5055 for any parents who would like to call in and make an appointment for the flu vaccine.
Can I just say that we have got a clinic in Stanground this weekend, and there's also a clinic at Doddington. I know that's slightly further out, but if that's not too far, people can make an appointment to
come in.
Yeah.
You don't provide for any walk-ins at all?
The problem with walk-ins is you have to know how many vaccines to take.
That's right. Yes.
So if, we wouldn't want to queue out the door if we've only bought 100 vaccines. That's the problem. And these vaccines need to be refrigerated and kept cool. So we really like to know the number of vaccines we need to take to the clinics because they're not near our main fridges.
That's right. So if you just listened to Nicky, you can actually book your child in for an immunisation appointment, and the number is 0300 555 5055. I repeat, 0300 555 5055 to make an appointment. And those hours of operating are from
8 till 4.
8 till 4 o'clock. You can access those lines to book in a flu vaccination for your child. Now, how many times would you actually be going into school? So I guess let's go a little bit back. So the process usually is a form is sent home.
Go on, Laura.
We have
We've
problems
gone
with those,
online.
don't you?
Yes, last year we did our first online consent form. The reason for this is because we found that we ask certain medical questions. A lot of the consent form, when it's written on paper, is not filled out correctly. There's information, vital information that we need to know before we can safely give a vaccine that is often missing, which then evokes phone calls to parents to try and rectify and get the information that we need. So we've gone on with an online consent form. Also, you can imagine the amount of paper you need to do 70,000 consent forms. It's just got too big.
That's right.
So we have an online consent form. The link is sent out to the schools for them to send home to parents, and that's usually done via the email communication from each school. And the consent form is really easy to fill in. It's actually easier to fill in the online consent form than it is the paper one, and that comes directly back to us. The information is then safe and secure. Nobody else is reading that. That comes straight back to us, and then we then check to make sure that the consent form's okay and that the child is safe to have the vaccine, and then we use the laptops and things at the schools in order to access the consent form at the school.
Sure. And just for the parents' purposes, because there are many people or parents from ethnic minority populations who might not use the internet as much, or
that's fine.
So for them, a phone call would be sufficient for them to gain that information.
Yes, we can all do that. Often we can fill in the consent form if they phone. We can fill that in over the telephone, or we can send home a paper one if that's going to be easier, because we know that not everybody's got access to the internet. We can text the link so it comes up on the phone instead of it coming via a laptop or computer. We really try hard to reach everybody. The thing is we really need you to book into the school sessions, because we are a small team, and yes, we do put on clinics throughout the flu season, but they're extra to our working hours, and we are only small. And the idea is to get the children seen at school, because that's where they are and that's how we can see most of them. So if people could look out for the links coming out, they come out in September. Fill your consent form in. You only have to fill it in once, please. It's so much easier. Parents haven't got to take time off work to take the children anywhere. They're seen in school. It's so much easier.
It is very easy. And actually, thinking about that, I have 4 children, and the amount of times, actually, because of the many things that I do, I forgot to tick the box whether I wanted my child to have the flu or not, really, but sent the form off because I would. And the amount of times, and now listening to it from yourself as to how much work goes into this program, it really does. Hats off to you, because I was called, I think, about 3 times. I missed the calls to say, but are you okay for this to take place? And there is a tremendous lot of work that goes into this. Absolutely, it does. So listeners, if you are listening, the flu vaccination, let's talk about, before we move on to the gelatin business, let's talk about how dangerous an illness flu is. Now, Dr. Thomas, there was an epidemic of flu once upon a time in the early 19th century, wasn't there, that really did wipe out a very big population of human beings.
Yeah.
People don't really quite understand the gravity of this illness that is flu. I contracted it once as a GP trainee, and I literally thought I was going to die. It was very, very horrible. Can we explain to our listeners a little bit about how serious this illness actually is?
Yeah, so flu virus is a difficult one to tackle because the virus changes its form year on year. That is why we have to produce a vaccine every year, and people at risk have to receive the vaccine every year. It's not like the childhood immunisations where a child gets vaccinated against polio, and the child is protected from polio for many years into adulthood. That is not the situation for flu, because the virus changes form, and hence we have to produce a new vaccine every year based on the different strain that is circulating at that time. to offer protection. So what happened was that, like you said early on, 50 years, 100 years ago, when the vaccine manufacturing technology was not developed, when a flu virus, a newly formed flu virus circulate in the community, none of the people will have immunity to it. And people will get the flu virus, they become very ill with fever, body ache, because flu virus attacks the body. It's mainly it's called a respiratory pathogen because it gets in through the lungs, affects the lungs, and then it spreads across the body, causing all the symptoms. And then with people with underlying conditions like heart disease, diabetes, kidney disease, or liver disease, they get very ill when they get flu on top of their weakened situation, and they die off quickly. Then with very new flu virus, even the healthy population won't have any immunity, and even we'll see that after the frail people die, the healthy people will also start dying with a very new flu virus. So if you go back 50 years ago, there was a big situation called the Spanish flu at the time that killed millions of people across the world, millions of people. So flu can wipe out a large section of the population.
Yes.
Now, the recent one that comes to mind is the 2009-10 swine flu.
Yes.
That is the one we all have in our memory because the swine flu came. It's called the H1N1. So there are two types, the A type and the B type. And under the A, there's the H1N1. That's a swine flu.
Yeah.
And that came as a new virus, emerged as a new type of virus in 2009, which nobody had any immunity to. And as we saw in the middle of summer in UK, there was a peak of flu illness because it was a totally new virus. And because it wasn't a severe form of the virus, many people did not die from it, but we saw a large number of people getting unwell from it. So in a way, we were lucky that it wasn't such a virulent or dangerous form of the virus, but quickly we started working on it, and the vaccine manufacturers produced a vaccine against it. So now, with so much advance in medicine and technology, there is research going on to identify the flu viruses circulating, and quickly we can produce vaccine. But there is a lead-in time to produce vaccine, which is about 9 months to 1 year in a totally new virus, or 6 months in a virus that is circulating but changes slightly.
Sure.
So there is a lot of work going into identifying the virus. Then all the vaccine manufacturers producing large quantities of the virus vaccine. So like Nicky and Laura was saying, 70,000 children, primary school age children and preschool children in Cambridgeshire and Peterborough. And we are covering so many counties like that across the country.
Yeah.
So that is just for children. So if you look at adults and older people over 65 who are eligible for vaccine, there are millions of people who have to be vaccinated within that short period of time between October and January.
Yeah.
And if they don't get the vaccine early, and flu, like Nicky said, just before Christmas we had the flu viruses circulating and lots of people became unwell. So because they are not protected. And this year we have a reasonably good match between the circulating flu virus strains and the virus strains in the vaccine which offer protection. So when we hear there's a death from flu, we feel sad because there is adequate protection against it.
Yeah. Very wonderfully put. We've got a minute till we go to adverts now, and I wanted to share with you that in 2009, when swine flu was big news, we all underwent training. I was an A&E doctor at the time, and I was on night duty, and I got a phone call from a man who said, "Have you had your flu vaccination, or have you had your swine flu training?" And I said, "Well, yes." I says, "Is that the policy that's been drawn up by that bloke who sits in?" He said, "Yes, that is I, the Chief Medical Officer of England." So, yeah, I'm going to share that. So obviously wanted to share that on that humorous note, how important it was at that time that we all had to undergo respiratory training. And it was a very interesting interaction. So I hope you're all able to join me after the break, where we will talk a little bit more about the flu vaccine, gelatin content and other vaccinations.
Stay tuned to Salam Radio after this short ad break.
I love it. I love it.
It doesn't take much to bring some difference.
I love it.
You give some change, which makes a change. Because nothing gets mileage like a charity. Just a little change turns into a chain. And before we know it, the results are massive. So give a little to make a big difference. For donations, call now. UKIM 0207 387 2157.
Had a car accident or an accident at work? Accident specialists are experts in no-win, no-fee accident claims. Leave the hassle to us. Our multilingual settlement experts will manage the entire claims process on your behalf, with nothing to pay up front. We provide services such as credit hire, taxi vehicles, recovery, storage and much more. For full details on our range of services and a free consultation, call us on 01733 555 774 or visit our office at 249 Lincoln Road opposite the NatWest Bank. Accident specialists. Start your successful claim today.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
जब बात हो हलाल मीट की तो कैसे मुमकिन जिक्र न हो हाजी बाबा का। हाजी बाबा अज़दा में आपके लिए। हम अज़दा में अरसा 10 साल से जायद मुल्क भर में 45 से जायद काउंटर्स के साथ बेहतरीन पैकेजेस, हर वैरायटी का मीट और आला मायार के लिए आइए हमारे पास। चिकन ब्रेस्ट, चिकन क्यूब या कीमा सिर्फ 3.99 पाउंड पर केजी। लैम या शीप लेग, लैम शोल्डर और मिक्स सिर्फ 6.99 पाउंड पर केजी। बेबी चिकन सिर्फ 1.99 पाउंड पर केजी। आपकी सहूलत के लिए वक्त की बचत और मायार की जमानत, तमाम हलाल गोश्त और अशिया जरूरत एक ही छत के नीचे। हाजी बाबा हलाल मीट, फाइंड अस इन अज़दा।
Bismillah ar-Rahman ar-Rahim. On the authority of Abu Dharr, may Allah be pleased with him. Some of the companions of the Messenger of Allah, may the blessings and peace of Allah be upon him, said to the Prophet, may the blessings and peace of Allah be upon him, O Messenger of Allah, the affluent have made off with the rewards. They pray as we pray, they fast as we fast, and they give away in charity the superfluity of their wealth. He said, has not Allah made things for you to give away in charity? Truly every tasbihah is a charity, every takbirah is a charity, every tahmidah is a charity, and every tahleelah is a charity. To enjoin a good action is a charity, to forbid an evil action is a charity, and in the sexual act of each of you there is a charity. They said, O Messenger of Allah, when one of us fulfills his sexual desire, will he have some reward for that? He said, do you not think that were he to act upon it unlawfully, he would be sinning? Likewise, if he has acted upon it lawfully, he will have a reward. It was related by Muslim.
بسم الله الرحمن الرحيم. قال النبي صلى الله عليه وسلم من سمت نجا. He who remains silent is successful.
My name is Khalid Sadiq. I'm Saif Adam. Salam alaikum, this is Baraka Blue.
Yo, this is your boy Harris J.
Right, that's whilst we were listening to Baraka Blue ending the adverts. This is Dr. Shabina Asad Kiyum for the Body Health and Mind Show, returning to you after the break with a wonderful team of individuals, professionals that are delivering the flu vaccination programme within Peterborough. We have Nicky Srahan here, we have Laura from the service delivery team, and we've got Dr. Shyla Thomas, who is a consultant in public health. And just before the break, we were talking a little bit about the flu vaccination, and we were talking a little bit about the swine flu and how dangerous the flu or the viral influenza can be if it's contracted. And if you've ever had the flu, you will understand how unwell an individual can feel. And this is why so much importance has been given to this immunisation programme, especially for children who don't have much reserve, who don't have the ability to fight off such a horrible infection like adults do. Healthy adults, very healthy children can be brought down quite quickly by this. So I'd be really grateful if you could participate into this show and send us some questions on our WhatsApp number, which is 07745278978. And we have some questions that filtered into my personal Facebook, which I will be posing. But let's talk about the elephant in the room, ladies. Gelatin that is within the vaccine. Now, let's be specific. Is the gelatin, or it's very modified? Let's talk about the gelatin. So, why is it used? Pork gelatin used within the vaccine in the first place? We've got that information, don't we, that we can communicate to our listeners.
Yes, so porcine gelatin is used as a stabiliser. All vaccines need stabilisers to keep them stable, and this is just to keep so that it can be refrigerated at the right temperature, which is what we have to do in order to make them efficient and safe. When this vaccine was being developed, they did trial 40 different stabilisers, and it was gelatin that came out as the most effective stabiliser, which is why that has been chosen to be used. There's some research provided that shows that there is no porcine DNA found in the vaccine, which I think should be reassuring to listeners.
Sure. So that's very important, because I do have a question here by a lady who says that asked to the effect that we've seen that the vaccine, the gelatin within the vaccine has been broken down to the extent that only little particles remain, but it still has traces of pork DNA. And actually, we've had that validated now. And obviously, you want to remain anonymous, which I'm respectful of. There are no traces of the pork DNA within this vaccine. Just to let you know. So let's get that message out there. Honestly, this flu illness can become life-threatening if you have a child who suffers from asthma, or even in a very healthy child as well. Some children are very underweight. You've got picky eaters who don't have the right amount of the weight to height ratio, so it can be detrimental to life as well. So Nicky has just clarified that there are no traces of pork DNA within this vaccine. Is that the same in the injectable version as well, or is it just the nasal?
The nasal one is the one where gelatin is there as the stabilizer. So injectable ones use other adjuvants. So adjuvants are the ones which stabilize the vaccine. So we need the vaccine to remain potent so that when it is given, it will induce the immunity against the virus. So porcine gelatin is found in the nasal vaccine, which is the fluence one.
Sure.
Not in the injectable ones. But like I said, injectable ones, we don't want to inject children, which is a very unpleasant experience for children in the primary school age.
Of course.
And they will be put off injections because it hurts them and pains them. So when they really require an injection, if they catch an infection and they are admitted to hospital, it will really scare them off. So we don't want to give them an injection every year when they are healthy. So if there's a child with underlying heart disease or diabetes or things like that, they can go to their GP and get an injection. But for healthy children, the flu vaccination program started because the nasal spray vaccine became available. So that is a rationale behind starting offering the flu vaccine to healthy children.
Sure.
Yeah.
And I think the golden nugget of information that I'd like to repeat one more time again is the fact that this year's flu is actually protective against the strain of flu that is going around currently in the community, which is brilliant.
Yeah.
And that's something that I really would like our listeners to take on board. Now,
and also that I just wanted to add that of the pediatric deaths reported in October, November, December, because flu was attributed as one of the causes of death in a small number of children, the National Medical Director in NHS England Improvement asked for an analysis of whether the children were offered the flu vaccination, whether the school visit happened before they became ill, or if they had an underlying condition, did they go to their GP to get the vaccine. And they did an analysis of the small number of deaths, and they found that some children did not get the opportunity before they became ill. Some children, unfortunately, their parent carer did not take them to the GP on time, or if they took it, the vaccine supply issue meant that they had to schedule another visit. So, when you say deaths, you are very right. There are children dying in this country. in this winter season itself, there have been a small number of deaths in children from flu.
Sure.
Mainly in the north of the country.
In the north of the country.
Yeah.
Do we know whether those figures run into double figures or triple figures? Do we know at all?
No. They're not double figures. They're just between 10 and 20.
Okay. So at least we know. But actually, even one death within 21st century... What is it,
for
21st?
a preventable,
21st century.
For a preventable illness is one too many. And I say I'm quite one of the most open and blunter worded individuals, that it would only take one death within Peterborough of a child to realise how serious an illness like this can be. And no doubt there must have been somewhere in the past. So it's very important, listeners, that you understand how virulent and how serious this infection can become, especially in children, and especially children that are at risk as well. And I'm part of many groups. Many people ask me if they should be giving their children the vaccination, and I endorse that, and more so because we have a team who are here to answer your questions. Now, the follow-up question that I've had from the previous lady, she has said to me that if it was a choice for me to give the injectable vaccination to my child, could I pay for it and get it done?
No, for healthy children without any long-term health complications, there is no alternative to the nasal flu vaccination.
Sure. And then again, the injectable version doesn't guarantee immunity against this year's strain, does it?
It does provide immunity against this year's strain, but
Sure.
always the live attenuated vaccine is much better in inducing immunity and protecting
More
against
quickly.
all the 4 strains covered by the vaccine.
Yes.
Because it is a better vaccine, the live attenuated one induce better immunity, and because it is a nasal spray, that is the one that is recommended for healthy children. For
Sure.
children with risk conditions, they have the choice to go to their GP to get the injection also. But for healthy children, yes, it is the nasal spray that's the only one that is available.
That's right. And we've got to be very open about the fact that we have a significant Muslim population here within Peterborough, and the belief is, and the statistics show, that the uptake within this ethnic group of community is very low.
Extremely low.
Okay. Do we know how critically low this is?
Yes, it's so low that there's no herd immunity.
Oh dear. Okay. And that is why we are seeing a surge of patients within GP surgeries and indeed at the hospital A&E with these upper respiratory tract infections, which are influenza. And in fact, I do remember an admission of one of my patients a few years ago because of contracting flu, and they were taken into an intensive care unit. So that's how serious this can become. So let's try and talk about how we can make or get the message out and be a little bit more effective at getting the message out. Obviously, one is here in the studio, and it's wonderful that we're able to get this message out. And I would like to convey on your behalf that if you are one of those parents that is thinking about it, or with your children, we all know how, when a child becomes unwell within the home, how it actually affects the wider family unit, and it means taking time off work because the recovery period can be slow, can be anywhere up to 2 weeks to have active symptoms from the flu. So you'd want to avoid that, especially when this year's vaccine protects against all 4 strains of flu. There's nothing more worse than being called to school that your child is burning in fever and is very unwell, and now you have to take time off work or whatever it is to take care of that child and to see them in that condition. So to protect them from that, please do ring the number, which was 0300 555 00 5055. So 0300 555 5055 to make an appointment to get that vaccine delivered. What else can we do in the community, Nicky and Laura?
Well, we've engaged with the local pharmacies. They have information about the gelatine content of the vaccine. Most pharmacies should have some information that they can share with families and communities. But we'd really like to make a video with the help of the community. We'd like to film a very short film, say a 90-second film showing a family going to a school and actually having the nasal flu vaccine. So we'd love to hear of any volunteers, and we'd also like to engage with local community leaders so that we can keep going with this and year on year see our uptake grow.
Yeah, so the thing is this community is really important to us. There are young children, there are pregnant mums, there are grandparents who currently at the moment, because the vaccine uptake is so low, aren't protected. Now, you're very important to us and we want to come and protect you all, but we need your help. You need to come to us really as well. We can only meet you halfway.
Yes,
we can't do anything about the gelatine content of the vaccine, but we can protect you and your families against a very nasty virus.
Yes, and it would be so wonderful if we all came together and were able to see a surge in uptake of those individuals. And the message is so important, especially for our vulnerable groups such as pregnant ladies. I feel that they are in that sort of vulnerable state. Their immunity goes down automatically, and obviously trying to safeguard the well-being of their unborn child and the health of their unborn child as well. Briefly before we go on, I think that this would be an ideal opportunity to say that as GPs we've given health talks within the mosques as well, so it may be a good opportunity to take this forward to some of the mosque chair people to give a talk on flu vaccinations to the community to see if that would help as well. So this is something that we can possibly do outside this show as well. Now, the other question that we have is, can you make a comment on the heavy metal content in vaccinations?
I think your listeners referring to the mercury component that used to be included in some vaccines. The thiamersil is a mercury-based preservative, and it used to be used to prevent the growth of bacteria in vaccines, especially when you have a vial that you have to open and take multiple doses out of. But the evidence shows that thiamersil was removed from the UK from all vaccines between 2003 and 2005, so there's no longer any vaccines in the routine childhood or adult schedule that contain thiamersil.
Okay, so that's wonderful. So I hope that has put your mind at rest for the gentleman that's just asked me that question. And we have another question here from Sister Michelle. So immunising your old child is in fact protecting the wider family and the rest of the local community, especially our elderly and other vulnerable people, isn't it?
Absolutely.
Talking about herd community, weren't we?
Yeah.
So would you like to say anything further on that?
Well, obviously we go into the schools to protect the children. That's our first aim. But while we're protecting the children, and Dr. mentioned about children being very, very good at spreading viruses, you know this at home.
Yes.
You know that if there's a vomiting bug going around, most of the children are off in that class. So the idea is to protect the child, yes, but you're also stopping the spread, stopping the children spreading that virus to the whole of their family, their friends, extended aunts, uncles, and therefore the virus doesn't have that ability to spread amongst the whole community.
Yes, and it's that very thing, that herd immunity that we're talking about, that is so effective in making sure that the vulnerable groups that can't have the vaccination, for example, well, the vulnerable groups do get the vaccination, but the other groups that can't have the vaccination are also protected against this terrible illness too.
Well, actually, they're relying on us.
Yes.
They're relying on all of us to get protected, to protect them.
Yes, people like me, for example. But I would actually, no, because I've had my flu vaccination by being a health worker.
Yeah.
But the mums that are looking after the children as well, and the wider family members within the family unit, for example, that are otherwise healthy, don't have any other underlying medical illnesses, but yes, if they were hit with the flu, then they certainly would go downhill very fast, wouldn't they?
Yeah.
That's been wonderful. Is there anything else you wanted to add about flu before we moved on to the HPV vaccine?
Just that I would like to encourage every listener to, if they are eligible for the vaccine, they definitely should go to their GP and make an appointment to have the vaccine. So this includes people over the age of 65 years who will get it free on the NHS, people with underlying risk factors like heart disease, diabetes, kidney disease, liver disease, certain neurological conditions like stroke. They should also make an appointment to go to their GP. There are other people like carers who are free, who can receive free flu vaccine on the NHS. They are both the informal carers at home who look after people with disabilities or an elderly relative, or there are social carers who work as social workers or in a care agency. They're also free. They can get the flu vaccine free from the NHS or from any pharmacies because they are a carer, social carer. So all people who are eligible should go and take up the flu vaccine. And the big group is the pregnant women. So with the swine flu, it affected pregnant women and became very unwell and lost babies. So all pregnant women are eligible for flu vaccine.
Yes.
So they should also go and have their flu vaccine. So this is January is the final month for people to have flu vaccine. There is flu virus circulating in the community. There are elderly people dying from flu in the hospitals. So every winter we see the death rates go up because flu kills more people during the winter months than people dying in the summer months. So like I said, this is the wonderful chance for people to get a protection against flu.
That's right. Now, we do have little time left, but I think it's so important to talk a little bit about the HPV vaccine. So it's being offered to boys this year, isn't it? I get asked lots of questions about, should I give my child the vaccine or not, or should I give permission for it? Now, we know that HPV is primarily a cause for cervical cancer in females. Why are we vaccinating boys?
Because HPV virus has got many different strains or types of different types of the HPV virus. So there are more than 100 different strains of HPV virus. There are certain types that cause cervical cancer in women, and that is the type 16 and 18 mainly, which is the vaccine gives protection to girls and young women who have had it from 70% of cervical cancers because they are protected from the high risk HPV. For it causes other types of cancers like anal cancer, other forms of genital cancers and genital warts, and throat cancers and oral cancers, so which are common to both boys and girls. So these types of anogenital cancers and oral cancers are also caused by HPV virus.
Sure.
So when we were, for the last 10 years, we were offering the HPV vaccination to girls only, mainly because the bulk of the cancers were cervical cancer, which kill young women, and we wanted to protect them. But then lots of people all over the world started asking the question, why are boys not offered vaccine? Because there are boys also who get lots of cancers, even though smaller numbers compared to cervical cancer. So they should also be offered protection against those types of cancers. And some other countries started offering boys the vaccine, and UK looked at the benefits that people were getting from vaccinating both boys and girls. So the country took a decision, the Joint Committee for Vaccination and Immunisation, JCVI, may call the policy decisions. So they took a decision that HPV vaccine should be offered to boys to protect them against anogenital cancers and oral cancers.
Sure. Now, just for clarity purposes, what ages is the HPV vaccine given to girls and boys, so that our listeners know that?
Yeah, so it's going to be offered to all boys and girls in Year 8 this year.
Okay.
There's no catch-up programme planned for any of the older children, but yeah, definitely any child that's in Year 8 this year will be offered the chance to have the HPV vaccine.
Is there another dose that's given, or is it just the one?
No, it's 2 doses. And when you sign your consent form, you're signing for both doses. It is really, really important that they get both doses. So they have first dose in Year 8, and then we see them all again the following year in Year 9 and give them their second dose.
Okay, so they will have 2 doses in Year 8 and Year 9. Now, what are the myths, or what's the scaremongering that surrounds HPV? Because I do get... In fact, I got a friend who works in the pharmaceutical industry who said, "Oh, do you think I should be allowing my daughter to have this? I'm a bit concerned." And I thought, well, what are the concerns? I didn't actually get to that. What is the scaremongering or questions that you get asked around HPV that
Well, a lot of it is around it being a sexually transmitted disease.
Sure.
The reason we give it to young people in year 8 is because we want them to be fully immune to the virus before they become sexually active.
Sure.
It's... we could give it younger, but it was felt at the time, 10 years ago, it was felt that parents wouldn't accept a vaccine being given to children that were younger than year 8. So that's how we started.
And the younger they receive it, the better their immune response as well. So we want to vaccinate them, if possible, before puberty.
Well, also, if they're over 15, they then require 3 doses of HPV, because their ability to produce a good immune response is that much less by the age of 15. So I would sign them up while they're under 15.
Sure. Okay, so that's one of the things. Dr. Thomas, is this a live vaccine as well, a live attenuated vaccine, the HPV one?
No, it's a killed
it's not.
one.
Yes,
Yeah, it's a killed one.
I would never remember this, so I thought I'd ask the expert. So it's not, it's a killed one. The reason why I ask that question is that we automatically then demystify the myth that says that we're injecting a sexually transmitted infection into someone. No. That was what the myth was, wasn't it? That we're okay.
It has no ability to produce
the infection
itself. It just produces, your body's responses to produce antibodies to the infection, so that it's a very common infection. People don't realise that perhaps, but the idea is that your body has the toolkit, if you like, to protect you should it come into contact with HPV when you're older, more of an adult and sexually active.
Sure. And are there any side effects to having this vaccine? Obviously, if it's a killed one, there's no question of anybody receiving an STI.
I think the scare in the media came because thousands of girls have been given the vaccine, but at the same time, when children are 12, 13, in the community, there are different types of illness that originate at the same time. So we have heard stories of mothers going to the media or through local papers saying that my daughter became so unwell, she became bedridden.
Yes, that's right.
Yeah, and she couldn't get up. And but if there are certain underlying autoimmune conditions, like certain illnesses, which manifest around those ages, the association between giving the vaccine in school and the child becoming unwell is linked. And they say that the vaccine caused the illness, but in most cases there is no causation. Vaccine doesn't cause any other autoimmune conditions or the girl becoming bedridden for life. But because these are very rare, but one story like that will scare people.
Yes.
So the vaccine has been given to millions of girls all over the world, and there is a good safety record for the vaccine. And the fact is that cervical cancer killed hundreds of women every year, but now the women dying from cervical cancer is coming down year on year. One is because of cervical screening offered in the community to women between the age of 25 and 65. And for the last 10 years, young girls have been offered the vaccine so that they are protected against 70% of cervical cancers, which are caused by the two main strains, that is type 16 and type 18 of the HPV virus. So you can see that a few years, like 10, 20 years into the future, cervical cancer will become a very rare condition.
It would be amazing, wouldn't it? It would be eradicated, just like smallpox, for example. Would be wonderful. Wouldn't that be just wonderful? We would all celebrate.
We actually asked for cure for cancer.
Yes.
And we actually have a prevention.
And we do, absolutely. And prevention is better than cure. We always say that. Last 60 seconds. First of all, I'm really thankful for you to come on the show in your very valuable time. But I will ask for a take-home message, one golden nugget of information to give to the listeners. What would you say, Nicky?
Vaccinate your children with everything that they can have.
Wonderful. Laura?
Please fill your consent forms in time and get them done at school.
And Dr. Thomas?
If you're eligible, go and have your vaccine. It is free on the NHS and it will prevent you from dying.
Absolutely, prevent you from dying. That's a very strong take-home message. And in the last couple of 15 seconds, I would like to say, pick up the phone, call that number 0300 555 5055 to book your appointments for the flu vaccination. We're going offline now with the Body Health and Mind Show. Thank you very much for tuning in. I will see you once more on a wonderful show with another expert.
Stay tuned to Salam Radio after this short ad break.
Where can you get high quality and low prices?